So coming to the seventh nerve. So seventh nerve is one thing where localization is expected at a postgraduate level. So you need to know each segment of the seventh nerve, how clear it is actually explained there. It is something you should definitely understand here. So it has four parts. The first part is the origin. So here you have all the nucleus here, first part. And then you have the second part. So which goes into the temporal bone. Then it bends. Then the descending part of the facial canal, and then the exit. So I've just divided those into definitive parts for you to really understand it. Now, so let's take the first one. So the origin is actually three. You can see that this bold yellow one is the actual motor fibers of the facial. So that originates from the facial nucleus. We call it as a facial nucleus. That is a motor fiber is yellow. Then you have the salivatory nucleus, which does the secretomotor function to the salivary gland. Secretomotor function. Then you have the solitary tract nucleus or the nucleus solitarius, which plays an important role in the taste fibers. So you can see very clearly that this is yellow, this is orange, this is brown. So there are three separate figs which originates from the brain. So at the point here, these two are actually separate. Just outside the point exit, you can see that the yellow is separate and then the orange and the brown are separate. Okay, so this is the origin, the three components and how it originates. But you see that the fibers of the salivatory nucleus as well as the solitary immediately joins together, right? So that ultimately we will call it as the functional chordae tympani, which comes at a later point in the course. So this is the first thing you need to really understand. The second one is the place. So here you can see that they are together. So in the previous slide, I showed you that these were separate, but here you can see that it's all come together. So this is the internal acoustic meatus. It enters together, all three are together. And here it reaches the geniculate ganglion, which is actually a swelling. So from the geniculate ganglion, the first exit nerve is the greater petrosal nerve. And this is the lesser petrosal nerve, which actually is formed not just from the facial nerve, but also from the branches from the tympanic membrane. So then it bends here. So here you have the nerve to stapedius. So when lesion is located in the cerebellopontine angle, we know that the motor fibers can be isolatedly affected and it can have the eighth nerve along with it that can be affected. Here, when the lesion occurs in the temporal bone, so theoretically both the motor fibers, secretomotor fibers and the taste fibers are affected. Therefore, you will have all these dysfunctions as far as localizing is concerned. But sometimes when the lesion is present there, you can have isolated motor involvement. When the lesion is at the geniculate ganglion, you know that lacrimation will get affected. And the plexus kind of nerve which originates from the tympanic membrane, others can also be affected. Then it comes down, nerve to stapedius. We'll know that dysfunction causes hyperacusis. So here, though you see that it's all coming together, the color remains separate. Though it's in a single bundle, there is a difference between them. So when you talk about the localization part, when nerve to stapedius and chordae tympani is affected, you can choose any of these sites, the first site or the second site, depending on whether the lacrimation is affected or not. But remember, isolated motor involvement is also possible. So you try to give a differential diagnosis. So when asked, you tell the lesion, all the three are affected. nerve to stability is affected, caudate tympani is affected, and also the motor fibers are affected. So probably the lesion is here or here, and justify your explanation accordingly. So the localization part we will take it at a later point of time in the clinical aspect, but here try to understand the anatomical perspective of the thing. So three things I want you people to remember at this L bend is the place where it enters in the internal acoustic meatus, they are all together. As you come here, you can see that it twists away. Geniculate ganglion is there, which gives its first branch, the greater petrosal nerve. Then it bends backward. The branch given is the nerve to stapedius. So next you need to remember is that here is the nerve to stapedius. So it comes down, the caudate tympani moves out. The caudate tympani comes down and it exits just proximal to the stylomastoid foramen. Here is the stylomastoid foramen. Just proximal to the stylomastoid foramen, it actually comes out. Right? So this is something you need to remember here. So the branch at the geniculate ganglion, the branch after the backward bend coming down the nerve to stapedius, and then the caudate tympani branch just proximal to the just before the stylomastoid. When it exits, before it enters the parotid, for what we call it as a pes anserinus, so which has the branches of the temporal branch, the zygomatic branch, the mandibular branch, and of course the branches which goes on to the marginal and to the neck, the platysma muscle, the cervical. The two branches are there. So one to the stylohyoid muscle, another to the posterior belly of the digastric. These two are actually given before the pes anserinus itself, but quite often this is not affected to that extent in clinical practice for anatomical reasons which is not that clear. Right? So this is the next thing I told you. So this is after that site. So you can see here that the branches are going. Actually the temporal branch is not visualized because that's an offshoot from the zygomastic branch. So you can see it in this bigger picture. You can see that. So here I just want you to understand the clinical course of the 7th cranial nerve and see how the secretomotor fibers come along, the orange fibers, and the brown fibers, which is the the taste fibers which comes along, and how it exits at a later point of time. So that is what you need to really remember, how the branches are intervening. At the same time they have some kind of a demarcation.